What do I need? Revision blepharoplasty, ptosis correction, epicantoplasty? I've had Asian blepharoplasty done when I was 17, and I'm fairly satisfied with the results. However, I feel as if my eyelids have begun to droop over the years, 7 to 8 years, giving me a permanently tired look. I went back to consult my surgeon to ask if I needed epicantoplasty or ptosis correction. He said it wasn't necessary, and that all I needed was a second blepharoplasty to remove more upper eyelid skin. I'd like to get a second opinion if that's really what I need to address my problem.
Thank you for your question. You stated in your question that you had Asian eyelid surgery at the age of 17, and over the course of 7 or 8 years, your eyelids became more drooping. And you are asking about ptosis and epicantoplasty, and you were given advice about removing more skin in your upper eyelids. And so naturally you want to see if you can get some clarification about what to do. Well, you submitted a single photo, and based on this single photo alone, I would state that you do have some degree of ptosis. Now, what is ptosis? Ptosis means drooping of the eyelid. And when we talk about drooping of the eyelid, we're talking about the relative position of the eyelid margin to the relative center of the pupil. And so when you talk about that level, there's a certain level that's normal, and then below that is, based on the number of millimeters, is the degree of ptosis. Now, before determining what kind of surgery to perform, it is important for you to at least see an ophthalmologist or an oculoplastic surgeon about this diagnosis of ptosis. Being young and having this gap between the age of 17 and 25 or so, that 7 or 8 year time frame, new onset of ptosis should involve some kind of medical workup. There are neurologic and other causes of ptosis that should be eliminated before moving forward with the surgery. Now, that being said, it is more likely that you may have had some degree of ptosis that was congenital. Congenital meaning you were born with it, and that over these last few years, the eyes drooped a little further and to a point where it's really becoming very apparent to you. I would respectfully disagree that taking away more skin in your upper eyelids would make your eyelids look more open. This is a very common strategic difference between specialists in eyelid surgery and non-specialists. A lot of plastic surgeons would see this as a problem with excess skin. But when you look at the eyelid margin, and you can imagine taking away a little bit of excess skin or even rolling up the skin, you would see that the eyes don't look more open. So in our practice, once we've established that this is a diagnosis of ptosis related to the muscle, this muscle is called the levator muscle, like the word elevator except without the letter E, we perform ptosis surgery. Ptosis surgery is performed under local anesthesia with light intravenous sedation. And this type of surgery is very tricky in a way, in that this muscle is very sensitive, and getting the right height, contour, shape, and symmetry is very challenging. In our practice, we routinely actually sit up our patients during these procedures, and we will have them have the patients look up and down during the surgery, and of course they don't feel anything, but by having their cooperation we're able to get a better sense of what the contour will be when all the anesthetic and everything else is worn off. We'll even have sometimes a patient look in a mirror and see how much more their eyes are open. So of course there's no pain during this process, but it gives us the best predictability when we do this, because we think of it in terms of the eyes being open relative to gravity, and by sitting the person up, you are able to get a more accurate assessment. So in summary, from my perspective, you have ptosis. I think that a single photo is never adequate. You need to have a proper examination, have the eyelid measured, and the muscle function measured, and all the things that we do in part of a ptosis evaluation. And once it's established, discussion about the type of ptosis surgery is involved, and then move forward if you want to see those eyes open up more. But remember, prior to doing that, at least get an opinion, a formal opinion by a specialist about the cause of your ptosis, because we don't want to miss anything that is neurologic or not just directly related to the physical position of the muscle. So I hope that was helpful. I wish you the best of luck, and thank you for your question.